Today's episode is part two of last week. This is part one. Anyway, we're going to talk about the Regen materials, which is the world's first dental restorative suite of materials containing Bioglass 45S5. And last time we talked to you about how it buffers and protects the tooth from acidity. And today we're going to talk about is a study done by Dr. Nate Lawson. And in the study, he shows how the Bioglass. So today what we're going to talk about is a study done by Dr. Nate Lawson, where he shows how the Bioglass 45S5 can protect our restorative margins. And we're going to also talk about the restorative recipe. So Dr. Nate Lawson over at the University of Alabama, bright guy, great researcher, did a study to check out what the Bioglass would do in artificial caries model. So what he did was he prepared these preparations right at the CEJ of multiple teeth. And in those box preparations, he actually restored them with a combination of materials, a regular adhesive with a regular composite, a bioactive adhesive with a bioactive composite, and then mixed everything up. And then there was a control material that had kind of proven bioactivity that Dr. Burgess really liked. What they did is they took these teeth, they stored them in a demineralization solution for 4 hours and a remineralization solution for 20 hours, and they cycled those daily for 30 days. At the end of the 30 days, they sliced those specimens and they took a really close look at where the composite tooth interface was to see what happened there. And again, in episode one or part one of this series, I was talking about what if we could place direct restorations that had a lower chance of ever having recurrent decay or secondary decay at the margins. Now, when you look at this chart where the green bars go up, that means that we had the best inhibition. So remember that demineralization solution could break down a restorative margin. Where the green bars go up, that means that that did not happen. Where the red bars go down, that does mean that it happened there. So on the far left-hand side, you see that the highest green bars where we use the Regen adhesive with the Regen composite because both of those are bioactive. So that was the best solution to preserve the tooth structure. The next best was when you use a regular adhesive, a non-bioactive adhesive with the Regen flowable composite liner because that is a reservoir of bioactive glass. Now the Sentient N, which was the third highest green bar, that is a mixture. They have a powder and a liquid. You mix it together and it's kind of an amalgam alternative. So it's known to have good bioactivity, but if you look at that bar, it's not as high as using Regen adhesive with the Regen composite. So it was just there to show that this is very comparable, even better than what's been recognized as a good bioactive material. The red bars all go down. Those are just when you have regular composites, basically, that are unable to protect that restorative margin, and we saw breakdown there. So this technology is actually put in the Regen Pitt and Fisher sealant also. Why would you not want that to be there, right? So the occlusal anatomy of a molar makes it harbor more bacteria. So let's use a Pitt and Fisher sealant that has the Bioglass 45S5 in it. Now, the great thing about this Regen Pitt and Fisher sealant, especially in kids today, is a lot of parents don't want the BPA and the BIS GMA materials in their kid's mouth. So these are both BPA and BIS GMA free. It's hydrophilic, so you can kind of do some wet bonding. I know it's many times very hard to keep that area really dry. So you're going to still get a good bond, and it has that Bioglass 45 S5 properties in it. So I want to talk to you about my recipe for doing class 2 restorations. So the first thing I do is I prepared my restoration, and down by the gum line, sometimes because that's where the plaque and the decay has been, sometimes you'll have some bleeding. So I control the bleeding and the crevicular fluid seepage with my QuickStat Free. And go back into past episodes of QuickStat Free. I love QuickStat Free. It does the job, doesn't stain the tissue, and it's very effective. The next thing I'll do is I'll apply my etchant. Now, typically I use Velvet Etch, which is the purple 40% phosphoric acid etchant. I'll put on the enamel first, and then I'll fill in the dental area. So I'm etching the enamel for about 20 seconds and the dentin for about 10 to 15 seconds, and then I rinse that off. I blot off the excess moisture. I don't need to have the dentin or the enamel bone dry, but I just blot off the excess moisture there. If I'm concerned about sensitivity, I'll use Desensamax. Desensamax has everything in it that you'd want to inhibit the P degradation in my hybrid layer and to create a less sensitive restoration. So I can shake the ball up for 3 to 5 seconds, get all the goodies mixed up, squeeze it out, place the Desensamax onto the prep for about 5 seconds, and then blot off the excess. We do not rinse off the Desensamax. It just gets down to tubules, blot off the excess. And now when we apply our Regen Universal Adhesive, that's going to be able to soak down into the tubules that have the moisture in it. It could be the Desensamax in them, so it's going to chase that moisture down to the tubules, and with it bring our Bioglass 45S5, which is going to help with the ion exchange and hydroxyapatite formation. So I let that universal adhesive soak in for 20 seconds, and I hit it with a gentle stream of air to evaporate off the solvent. Now, when I evaporate the solvent off, the adhesive gets thicker, so then I use more aggressive air for the next 10 seconds, blowing it from the prep towards the tissue. So we're not blowing blood and saliva onto the prep, but we're blowing everything away from the preparation so we don't contaminate it. Then if I'm sure that everything's looking good, I'll go ahead and I'll light cure that. And then I'll place some Regen Flowable Composite liner in the box. And so that liner is going to adapt very well, but it's going to be my reservoir of my Bioglass 45S5 down at that gingival floor. So I place that down the bottom of the box, and then I might cure that with my pink wave curing light. We talked about that in a previous episode because it has a depth of cure and the high power that I need to cure down in the bottom of my box. And then we place increments of composite, whatever your favorite sculptable composite is. Vista Apex Solutions, we have Exquisite as our composite. But whatever composite you use, I like to have it warmed up. So the phaser is the composite gun delivery system with the near infrared warmer at the tip, or you can use a benchtop warmer that Vista Apex has. But when you warm the composite up, you get better adaptation of the material to your prep. You improve the physical properties of that composite once it's cured. No, but now as I fill that up, I want to use my seam free. My seam free is my composite wetting resin because I can use that to sculpt my composite, and my instrument won't stick to that composite. So remember, the composite's been warmed, so it adapts really well. Then I take my seam free coated instrument, and it's just a little film of seam free, not a lot, and I can just begin to contour out my composite. Now the seam free is not going to affect the setting properties of the composite. It's not going to affect the physical properties of the composite, but it's going to help me shape it all so that I'll have very little adjustments to do once I cure this. Now I go back in with the pink wave curing light and I cure it thoroughly. And now when I have that thoroughly cured, a lot of times I take my matrix and everything out, I adjust the occlusion, polish it up, and we're done. And as I mentioned before, what I'll tell the patient is the material that we use today will help the tooth heal up, because there was bacteria in here. There was a hole basically in the tooth, and we had to clean that up. Or there was an old filling that was breaking down, and bacteria was leaking up underneath it, so we had to clean all that out. Then the materials that I used to put in the deep parts of the tooth, just like when you have a deep cut, was like a medicament. It's going to help the tooth heal up, and that's our Regen adhesive that we use. It gets into those tubules. We light cure that, seal that up, and then our filling material. In the past, our filling materials had just been something that we put in the hole. That's why it was called a filling. But the filling material that we use today not only fills that area, but it's going to protect the tooth because it has special properties. So when acid hits that, it's going to help to neutralize the acid so the tooth doesn't break down where the filling material and the tooth meet. So this material is going to protect the tooth while it's sealing, while it's providing the aesthetics that we've developed in this restoration. And I will tell you, patients really appreciate that. I've had lots of patients tell me, I would pay extra to have you use that material. And I tell the patient, well, in our practice, we're always trying to use the best materials. And so we're keeping up with the newest developments in materials. And this is where, we are today. Someday, hopefully, we're going to be able to add something back in your tooth that just regrows the tooth. But for right now, we've got materials that help to protect the tooth, help the tooth heal up. And so there's less chance of us having to replace this filling down the line, because we know the life cycle is small filling, medium filling, large filling, crown, root canal, extraction, and implant. And what we want to do, especially if you're working on your family members, is we want to stop that cycle early by, if we finding decay early, if we can't prevent it, and then try to restore it very conservatively, and then have that restoration last for a very long time. And by using the Regen suite of restorative materials, we're able to do that today. And that's what makes this so exciting, to offer our patients the very best. So if you like this information, hit the like button. And if you want to make sure you don't miss out on some of this material, hit subscribe. We really want to build that subscribers list up because we're trying to build a community of like-minded colleagues, trying to do the very best for the patients by using the best of materials and then knowing how to use those materials in the best of ways. And so we're trying to bring you these little snippets of information to help you. And if you have any comments, leave them down below because I'd love to hear what you like, what questions you have, and we just keep growing better together. Thank you very much.